Hello, everyone, and welcome to the Transformational Storytellers show. It is Thursday again, and here we are with another amazing guest, my amazing friend, Dr. Lidia Molinara. And I love Lidia, but I also admire all of her work. She's the founder of Mom's Healthcare Navigator. Look that up. You won't regret it. And she's also a keynote speaker. She's been featured at TEDx and the United Nations. Dr. Lidia Molinara is a 30 plus year practicing pharmacist. You don't look a day over 30, Lydia. She's also a patient safety officer. She's an award winning author. She's a mom of three. So she knows all there is to being a mom and also everything behind the scenes on healthcare. She helps mom become confident in the healthcare advocacy journey, and she uses a proven method that we're going to talk about. I'm not going to tell you what it is yet, but you're going to learn how to communicate and advocate and educate yourself. And her mission is to replace fear with calm confidence when it comes to all of the things healthcare. So, welcome, Lydia.
Thank you so much. I'm so excited to be here with you.
Oh
Yes, this
my
is going to be
God.
great.
Yes, it's going to be the Dr. Molinera show, and I'm excited.
We'll
Oh
learn lots. We're going to learn lots today,
my.
that's for sure.
Yeah, so I'm really happy that you're here today because it's Women's History Month, as we all know, and soon we'll be celebrating International Women's Day. And you participated in an initiative at the United Nations called FemPower, which is also a book, and we work together to bring that story to life. And I would love for you to share, because it's the Transformational Storyteller show, to share that story from Fem Power that we brought into the world. And I'm just really gonna say how much I honor you for sharing this story today.
Thank you. I will. I'm going to read it. And I think what you'll see in the theme of this is that even being a healthcare professional student and someone who was in the thick of it, I myself learned how to navigate while I went through these things. And that is the power of understanding when you've gone through healthcare and you've had an experience where you do feel unseen and unheard, how important it is to get those skills. So it's really the look both ways before you cross the road skills you need, but in healthcare. So here we go. Our voices shape optimal healthcare journeys through advocacy. It's a memory, this story. I was lying in bed one night when a sudden searing pain relentlessly tore through my upper abdomen. Each breath felt like shards of glass scraping through my insides. A sensation so painful, it made me wince in pain. It was clear that this was harrowing pain, not a passing discomfort. I knew I had to wake my parents so that I could go to the emergency room, despite it being 3 a.m. on Christmas Day. In the hospital room, I waited for hours with no ability to even sit or stand because of the agonizing pain. We finally saw the emergency doctor, but he dismissed the pain as heartburn due to a larger than normal holiday meal. He provided a drink called a pink lady, which was a mixture of lidocaine, a pain blocker, and Maalox, an antacid, and I was sent home. Back at home and still in the same amount of pain, I felt unseen, unheard, and helpless. I racked my brain, wondering what could be wrong. As a fourth year pharmacy student, I thought it didn't fit any classic symptoms of appendicitis, pancreatitis, or gallbladder disease, as the norm for that was classified as 40, fat, and female. Yes, this is what they taught us at the time. I made a total of 7 emergency trips over 90 days, and my body was withering away. At 5 feet 4 inches, I weighed a mere 80 pounds, surviving only on water and bread. Each cycle of pain became an unwelcome 7 to 8 hours lying in bed, holding a wet cloth to my head and waiting for the time and extreme pain to pass. I would drink Malox and then vomit into the sink right after because of the terrible taste. It would be so bad that I couldn't take it any longer, and eventually I would end up in the emergency room again, waiting for hours and going through the same rinse and repeat cycle. It was only ever a diagnosis of heartburn and a pink lady solution that did not help. And I love that it's a pink lady. You'd think that it would be some miraculous cure because it's called Pink Lady. Anyway, the cycle of misdiagnosis and misunderstanding weighed heavily with each emergency visit, enduring the feeling of being a mere statistic in the system. I became extremely frustrated. I refused to be pacified by Pink Lady medication solutions any longer. As a soon to be healthcare professional, I thought doctors knew best, that it wasn't possible they could misdiagnose. But the repeated attempts to seek answers that did not resolve my issue clearly meant this was simply not true. And I found my strength and a resolve to advocate for myself. While I was in one of my many excruciating pains of episodes of pain, I asked my mom, please drive me to my family doctor.
Mm.
Without an appointment and with barely the ability to walk into the office, I requested to be seen. Once the doctor came into the room and saw me, he advised, go to the emergency room and demand an ultrasound immediately.
Wow.
On my seventh emergency visit, I was hardly able to take a breath to speak. I told the triage nurse, I'm in 1,000 out of 10 in pain, and it has been like this for over 8 hours. I presented my written documentation of my health situation and explained that I had just left my family doctor and he had told me to get an ultrasound immediately. The nurse personally helped me into a wheelchair and wheeled me into the emergency room to be seen by the doctor. When the doctor came into the room this time, I actively engaged and reiterated what I explained to the nurse. I presented my journal showing how many times I had gone through this pain and demanded an appropriate painkiller while I waited to have an ultrasound. I realized that my voice spoke volumes. The emergency doctor did not give me a pink lady this time. He ordered a narcotic painkiller, and within 2 hours, I could actually breathe. I knew from my pharmacy studies that the painkiller he gave me helped with gallbladder duct spasms. So I concluded that he thought I had gallstones passing through me. He also ordered the blood work to check my liver enzymes. Once I felt better enough to engage, when he came back to check on me, I spoke to him about the possibility of it being gallstones. And he simply replied, I can't believe no one had done an ultrasound yet.
Oh,
The very next day, the very next day, I was in surgery to remove my gallbladder after the ultrasound showed that the gallbladder was full of gallstones. I was lucky that I didn't get an infection or display any issues with my liver, as these complications can occur. The invalidation I felt propelled me to spread awareness of how this experience taught me to navigate the healthcare system so that we could all be seen. I learned the three key principles that make up the acronym ACE: advocate, communicate, and educate. I further learned that symptoms are not always clear, and the inability to diagnose can often be met with dismissiveness. This notion of it's nothing to worry about and it will pass. Therefore, it is extremely important to track and record your symptoms and to advocate your concerns. If you are feeling dismissed, the best approach to take is to communicate. And here are three simple questions that you can ask. I'm wondering, How should I cope with this pain? And when should I come back to be reevaluated if things get worse? Are there any tests that can be done to try to get a more definitive answer as to why I don't feel like myself? When should these symptoms go away? Or when will I feel better based on the treatment plan you outlined? When there is not a clear-cut diagnosis, sometimes it is a waiting game to see what happens. But you'll want to be clear on when you should follow up and when you should access that care. Should you go to the hospital, an urgent care clinic, the doctor's office, or just take an over-the-counter medication or prescription medication to help? The primary healthcare professional should provide you with a treatment strategy. And if the issue hasn't been diagnosed yet, remember to continually seek answers and ask about what tests, medications, or labs could lead to a diagnosis. In addition, as caregivers, we often prioritize caregiving for our families over our own healthcare needs, neglecting preventative screening, symptom documentation, and follow ups. We also need to make time to take an active role in our own healthcare and to advocate for ourselves in all healthcare encounters. We do need to do our research from credible sources, pay attention to these important dates, schedule the follow ups, and go to these appointments. It is difficult since it can be disheartening to be told that nothing is wrong when you feel like there is an issue and it's not resolving. Again, I would have the treatment plan outlined by asking what you need to do to be seen, essentially.
Mm-hmm.
If you are not being seen or heard, despite you asking questions and trying to seek answers, then if possible, I recommend you seek another opinion. This is also a way to manage the situation. In my case, it was when I went to see the family doctor as my second opinion. He gave me the insight to ask for an ultrasound, and that helped my diagnosis. So we also need to think of it as asking another friend for their opinion. It isn't going behind your primary caregiver's back, but rather seeking more information. I also have clients that get three opinions, and at times they can all be conflicting. So, this is where the importance of trusting your instinct and doing your research can help guide you to the best decision. Use your pharmacist as a resource as well. They are a wealth of information and a frontline accessible healthcare professional. It can be overwhelming, but feeling unwell, it's not a fun place to be. So do your best to seek answers. After finding an opinion, try the treatment plan and see how you do. Not every plan produces results as expected, so it really becomes a trial and error situation, and it can be time consuming and frustrating. Time also produces more clues, so it is important to monitor, track, and record opinions, signs, and symptoms. This process helps with getting closer to a diagnosis, and it also is important in preventing errors. Having dealt with my own healthcare ordeal, I realized that across the globe, we face significant challenges in healthcare errors and medication mishaps. We are often taught that raising our voice in healthcare is wrong, but we have to shift this perspective. It is the very thing that will save and protect, and it's a necessity. It's not challenging authority, it's establishing your concerns. Errors such as misdiagnosis are a segment of the things that can go wrong when seeking healthcare. The World Health Organization actively promotes World Safety Day to raise awareness of preventable errors in healthcare. The most common errors occur with medications. According to the World Health Organization, there are over 3 million deaths a year from medical errors. And 50% of these are caused by preventable errors. Preventable.
Wow.
Those medication errors are the highest number of preventable errors. It is extremely important to understand the medication treatment plan, how to take medications correctly, what to avoid with them, their side effects, when you need to go back and seek medical attention, the name of the medication being prescribed, the strength, the directions, the duration of therapy. When you go to the pharmacy, you can confirm that the pharmacist has given you the correct medication and that it matches with what you were told by the prescriber. Also, it is so important to tell your pharmacist about any other medications you take, such as over the counter medications, herbal products, supplements, or illicit substances. These products can interact with prescription medications. When picking up your prescriptions, confirm with the pharmacist how to use the medication. If you have allergies, ask, will this be a problem with my allergies? And be sure to name the allergy. Example, my penicillin allergy.
Mm.
This helps to make sure that no one has missed the allergy interaction. It will also be helpful to check online to confirm that you know even before you go to the pharmacy if the medication will create an issue. And be honest. If you're not taking medication, then express this. This way, the treatment plan can reflect exactly your health situation and prevent additional tests, more prescribed medications, and further misdiagnosis. So, as I embarked on my role as a pharmacist, I vowed I would hear the voices of my patients who felt muffled and to empower them with the knowledge of ACE. So, let's go through ACE. When you advocate, you remove the barriers. Take them away so that you can speak up, lean into your intuition, voice your concerns, and push for the answers. When you communicate, you provide clear reporting of your health situation. You record, track, and keep accurate records, and you present those in a truthful, clear, and concise manner. And when you educate, you learn about the treatment plan. You do your research from credible sources, you develop questions from your research, and you ask them. You understand the risk versus the benefit of the treatment plan, and you follow up and check to make sure the plan is delivered correctly, it's working, and is monitored.
Mm. Oh my goodness, there is so much there. Thank you, Lydia. Thank you for number one, sharing your story, and number two, sharing so many just golden nuggets to navigate healthcare. There's so much to unpack. I really love ACE. So it's advocate, communicate, and educate. Everybody write that down and make sure that you go to momshealthcarenavigator.com because Dr. Lydia is sharing a wealth of information on how you can practice ACE. We could only cover a little bit from the book today, but she's always informing us as to how to be on top of this. And one of the things that really resonated with me, especially as we celebrate the legacy and the history and the power of women this month, is how you talked about the dismissal. And I feel that in your story, the the pain and the discomfort was almost equal to the feeling of dismissiveness that you talked about of it's nothing to worry about. In other words, it's all in your head. And you had to come in and say from 10, from 1 to 10, I'm at 1,000. And so these are hard stories to talk about. And I want to ask you, because we're in the Transformational Storytellers show, why do you feel it's important to tell your story? And what was the process like of crafting this story to share with everyone?
Well, this, it's a transformational story. So the way that you kind of want to explain it and do it and the format that was provided with it in the story format was to really make sure that you focused. And what I wanted to do in that writing of the story and the process that I had to go through is, of course, I have my version of the story, but putting it together so that it would really resonate with the feeling, the pain, and the struggle that I went through, and then coming through that and realizing with my pain and struggle, there was an outcome. And what was the realization of that outcome? How did that and how could that inspire and bring peace and sort of some sort of knowledge to other people? Because We all have our stories. And I think in healthcare, every person, every mom, every caregiver, every person can explain this story. And in light of what you're saying, with women especially, we don't have enough research in healthcare. So many things are not diagnosable because we just don't have the research to understand what they are. And so something as simple as endometriosis. Women have been dealing with that for over 30, 40, 50 years. And there hasn't been this information and knowledge and research to understand how painful it is. It's not just, oh, take some Advil, you'll be okay. You're just having a painful period this month. It's worse. It's more than that. And I think, when we look at now, when women are now talking so much about menopause and what we need to do, we were crafting research and making decisions based on a 60 years ago. Imagine if we did that in technology, that we would be working in technology today, 60 years ago. So it is really important when we look at stories that we bring this to everyone's attention. The more we voice our concerns, and the more that we bring these stories to light, the more things can get looked at, the more things can develop a research. There is a need to research this. We have many women complaining about this. Why? What are we going to do about it? So I really think it's really important that the story process was so bang on with how you could explain something in a very concise but very clear method. And it was transformational for me. It is a transformational storytelling experience because it transformed the way that I explain things as well, so that people really do get to the heart of the struggle, and they understand the struggle, but then they know there is an outcome and that there is a resolution to it, and there is a way to move forward with the struggle. And I think that's really important because we don't want to just sit in the struggle. We want to be able to move forward. So it's a really effective method in explaining the situations that we need to voice.
Thank you so much. And I love what you said that there are many women complaining, and we sometimes don't still do anything about it. That's the kind of system that we have. And I heard something once that really took me out. It was something called WW in healthcare that was put on women's chart to indicate that it was a whiny woman. And so even when we complain, we are then judged for complaining. And sometimes in people's charts, it was written to dismiss and to say, hey, when you look at this, just know this is a whiny woman case. And this needs to stop. And I'm really just grateful for the work that you're doing to help us trust our intuition. You said, you're giving us permission to get not one second opinion, but a third opinion and many opinions. And I love how you take the guilt out of this. And it's incredible how we as women sometimes think that we are questioning our loyalty to take care of ourselves. And I love how you give us permissions, take, find out, do research, but also listen to your gut. You are not crazy, it's not in your head, and there's something going on. And come to find out, the ultrasound shows all those gallstones, and it validated. How did it feel? I'm wondering.
Isn't that funny that you say it that way? Because, you would think, oh, I have a gallbladder full of gallstones. And it was a relief. How could that be a relief? And you're like, finally, somebody understands I have a problem. I
Yeah.
think the struggle when you don't have a diagnosis and being misdiagnosed for years, and I have heard this time and time again. I mean, I was at a pharmacy counter for a long time, and I've heard many stories, and a lot of them are women coming and saying, I finally got a diagnosis. And it's
Mhm.
almost like you don't even care what the diagnosis is, good or bad. You just want to move on now with the treatment plan. So we shouldn't get to that, right? I mean, we shouldn't have to. have that kind of a journey. But unfortunately, I can tell you the behind the scenes of healthcare, shortages, technology information that's being used that sometimes breaks down, you know, communication pieces between healthcare professionals. There are key critical points of breakdowns in healthcare that you do get lost in the system. The fall through the cracks, oh, that happens every day. So, part of advocacy is also this, you say remove this guilt. If you don't in this arena, if you're not on top of it, if you're not I really, it's almost like if I am not the whiny woman and if I'm not the one in control and if I'm not the active participant, I will have a healthcare error happen to me. Not a
Mm,
question of will it, it's a question of when. Because behind the scenes, we are on our knees in healthcare. There is an overwhelming amount of misinformation, of things that are going on in healthcare where there's shortages, where there isn't enough resources, where the information keeps changing. You have very, high administrative bodies that change their regulations on things, change the way that protocols are written. So it's an ever evolving process and it is difficult. So it's difficult as a healthcare professional and it's difficult as a patient. But I can tell you, the people that navigate the healthcare system the best are the ones that are actively involved. If I just left it and kept not going back to the emergency or
mm,
not doing anything about it, like I'm going to tell you, one of those stones was going to create a problem and I was going to end up having a liver issue. And then it goes to imminent death. And
yeah.
so trusting your instinct, I love also what you said about that because you need to give yourself that power.
Mm,
Women know. And when it comes to your children as a mom, nobody knows your children best. We
mm,
are innate when it comes to them being sick. We know. And we know, and we have that feeling where it's like, I don't know about this. And that's when I tell moms, you have the I don't know about this feeling. That means you go. That doesn't mean oh, they're going to think, who cares what anyone thinks? Get it checked out. I've had many moms that say, oh, my son fell. He banged his head. I waited, but it kept getting larger and I didn't know, but something told me I should go and then they end up seizing in the emergency waiting
mm,
room. Well, that's better to be there than to be at home and then
mm,
having to call the ambulance or all of those things. So and maybe you're far away and maybe the ambulance doesn't show up in the 5 minutes that you're thinking. So and I think knowledge is power. It's about spreading awareness, as we talked about with these stories. Some of these stories are horrible. Some of these stories did not end well. I have heard stories of medication errors that have caused deaths in children. These are the reasons why you need to be an active participant and you need to use a system like ACE because it clearly outlines your steps. It's just a step. Advocating means you speak up. Communicating means that you record your information. Educating means that you take the information and you start reading and you start looking at credible sources. You go to the Mayo Clinic, you go to the ones that are governmental body agencies or, pediatric association, the ones who are led by physicians as well. You look at those and you check those resources. And I know there's lots on social media and I know that there's lots of information out there. You need to also vet it. So if you read something and you see something, take it back to your healthcare provider, discuss it, find out the pros and the cons of something. Because here's the thing that doesn't happen, we always don't know the other half of the story.
mm,
Sometimes when it's just a blitz and a campaign on something, use this, it's going to work for that. But what are the side effects of it? What are the other aspects? What's the risk versus the benefit? So make sure that that educate piece is there as well. And I really do find that even in my own self, with my daughter, with my children, when things have happened, when I do that and I come up with a treatment plan and I know it, and I know when I leave the emergency room, what do I do? Like what should I watch for? When do I come back? What is going to make a difference? Will it be in 3 days? Will it be in 4 days after using this medication? What's this going to do, this treatment plan? Go get an ultrasound. What are we looking for? You don't need to be in the dark. You can ask the questions.
I love that, and I love that you do this work in the world, and I was stunned when you share that statistic of 3 million preventable deaths. That's just insane. And one thing that I want to think about is about the work that you do in the world. I know you're a public speaker. As a matter of fact, when you were talking about the stories that you've talked about and witnessed, I was thinking about your TEDx talk. For everyone, make sure that you watch it. It's going to be in the show notes, and you can look for Dr. Lidia Molinara on YouTube and watch her TEDx. And all of these cases being preventable is really infuriating, but it's also hopeful when we know what you just shared. So I really love that. And I know that you said you took your journal to this nurse, right? To the triage nurse, and you showed her your documentation, your records of what was going on. And I know that you have something, you have a resource that you created to allow all of us to do this. So tell us a little bit about that.
Yeah, my healthcare journal. It's also a medical tracker and healthcare journal. And what I've done is made it easy to have all the information in one spot. I also put in the questions that you should ask so that you have a resource so you know when you're going in before surgery, if you're in an emergency, if you're speaking to a pediatrician, but also if you're speaking to the dentist or to the optometrist, so that you have the questions to ask so you know what you should be recording, some of the things that I discuss in the communicate piece. And I did it so that you would have your family history in there as well, the previous surgeries. And I did it for two parents, three children, and two pets, because we also need to advocate for them and explain what goes on. We don't just caregive for our children, we caregive for our fur babies too. So it's really important that I included that because that truly is most families. And so it does also include our pets. And so that's why I included that as well for our medical journal, to be able to track this information for the entire family.
Absolutely. I love how it's for the entire family because sometimes as moms, we neglect ourselves and we keep records for the children. And I love how you modeled that for us of here's a record of what I am feeling. But yeah, I love those fur babies as well. And one of the things, because we're about to end, one of the things that you shared is, about the social media information and one side of the story. And I loved in your chapter how you talk about the allergy. That's something like that we don't know how something's going to react to an allergy and naming those allergies. So much to look for. I know that you read it, and there's so much to digest. Make sure that you go to Dr. Lydia's website to order a copy of Empower, and you are able to read it and digest it and highlight it and take all the notes. But also, the journal is going to make that easy as well. So, what is one step that you hope, Dr. Molinera, that our audience takes after hearing your FemPower chapter today, after hearing your story and all of these tips that you share? We are overwhelmed with so much great information right now. So, give us some practical tips.
So, you know, we can acknowledge that healthcare is complicated,
Yeah.
but but it can be navigated. So I encourage everyone to be vigilant by using ACE. And so, some simple ways to practice using ACE: bring a notebook and a pen to every healthcare encounter. You have to provide and bring your personal health history, have it documented, family history, vaccinations, allergies to any medications or why you stopped a medication, and also, any surgeries, past surgeries, current medications that you're taking. Include your herbs, include your supplements,
Mhm.
and also any other relevant health information. Like, I remember when I was in the past with health history, this is what happened when I had anesthesia. That's going to be really important when you go into surgery, so that they expect it and know it and can prepare for those things ahead of time. And then, when you're going through your journey, record your signs and symptoms, include dates and severity. So remember, I was talking about 1,000 out of 10. So then I could express that, but I also had that recorded, that my pain levels were always 10 out of 10 in every one, and that how long they lasted. So it was really important to make sure that you have that and make sure that you bring that to every healthcare encounter. And then we talked about, for women, that we have to book our own appointments. We caregive for the world, but we got to look after ourselves first. And so make sure that you track screening and follow up dates and make it a priority to get to those appointments, and then document what the doctor explains to you. So, doctors now, when you go into the office, instead of them transcribing notes, they have a little thing and it transcribes AI. I think what we need to do is do the same thing. We need to write out everything that's being said, and so that we know what we need to do when we leave the office. Because most people, including me, we walk out and we're like, what did they say? Was it 3 times a day? So make sure you track that.
Yeah.
And so I really think that that's the key principles of ACE and what you can take away and do. And I really wanted to leave with this note. When we're most vulnerable and in need of healthcare, that's when we must be allowed to use our voice and be heard, to protect ourselves. And it's really important that we allow ourselves to use our voice and that we do use it to be heard as active participants.
Oh, so good. Oh my goodness. I want to see some comments. Everyone, what do you think about this chapter of Fempower and this interview with Dr. Lidia Molinara? I just I'm full. This is amazing. This is so helpful. The work that you're doing in the world is so incredible, so needed. Thank you for the work that you do, everyone. Make sure that you connect with Dr. Lidia Molinara at momshealthcarenavigator.com and all the social media platforms, and that you use the show notes to watch all of her content and read her content. Thank you, Lydia. I am amazed. You're incredible. I adore you. And you're named after my grandma. So,
All good things. See,
thank,
women's history. We've got it all going on.
yes.
Women.
Thank you so much for being here. And
Thank
thank
you
you,
so much
every
for having me. I appreciate
absolutely.
it.
Thank you. Thank you, everyone, for being here at the Transformational Storyteller Show. I'll see you next week. Bye.